Today, the Health Sciences Authority has announced that it has granted authorization under the Pandemic Special Access Route for the Pfizer-BioNTech vaccine. This regime requires 2 doses of vaccination administered 21 days apart and is recommended for individuals above the age of 16 years of age, but not at this time recommending the vaccine for pregnant women, immunocompromised patients, and those below the age of 16 due to the need for more data to emerge and be subject to that stringent evaluation process. They recommend that all Singaporeans who are medically eligible for the vaccine should be vaccinated. And the Ministry of Health has accepted the recommendations of both the Health Sciences Authority as well as the Expert Committee for the Coronavirus Vaccination. The Health Sciences Authority will continue to actively monitor the safety profile of the vaccines and track for adverse events that are associated with this vaccine, either globally or locally. And this will allow us to react quickly if we need to manage any safety issues that might arise. As a result of the recommendations coming out from the expert committees as well as HSA, we encourage all Singaporeans to be vaccinated as long as you are within the eligible group as recommended, so that you can protect yourself and we can achieve a high level of protection nationwide. Vaccination is one of the key enablers that will protect us and our loved ones against COVID-19 infection and allow the economy to open up for social activities to resume. And having this community immunity will help us to be able to safely and quickly return back to normalcy. The securing of access to COVID-19 vaccines occurs through a broad and diversified portfolio and strategy to ensure that these vaccines will come into Singapore in a timely fashion for vaccination of the population. The first shipment is due to arrive in Singapore at the end of December, and the stocks will continue to arrive over the coming months. We do expect to receive enough vaccine stocks to allow for the entire population to be vaccinated, but as the global vaccine supply is limited initially, while manufacturers continue to ramp up their capacity, we will need to prioritize those at risk and most vulnerable for that infection. And therefore, we wish to vaccinate those who have these high risks. In our plans, we intend to provide vaccination progressively, first protecting those who need this vaccination the most. And these would be the healthcare workers and frontline personnel most at risk of becoming infected with COVID-19.